One thing you wish every woman in her 30s or 40s knew about pelvic health, or even earlier.
I know, right? Forever. It's funny you asked that because I was just, making a video about this topic. And, so what I would say now, me being in my 40s, and, I'm just as guilty, is pelvic health is part of your health. So if you're somebody who is thinking about fitness, who's thinking about, eating, healthy, whether you are in your 20s, 30s, dedicate a portion of that time doing things to improve your pelvic health, right? We talked about Kegel exercises. It's not just Kegel exercises. It's a lot about core strength. It's a lot about, flexibility. Remember, our muscle, the purpose of muscle is not to just bulk it up. And one thing that I always tell my patients is you want your muscle to be like a yoga muscle. You don't want a bodybuilder muscle that's just bulky, especially not your pelvic floor, right? And so, what I mean by that is that learn how to contract the muscle to tighten it, but also when needed, you should know how to relax those muscles. Because your pelvic floor muscle, yes, it helps prevent things like pelvic organ prolapse, incontinence, bowel issues, but you also need to be able to urinate properly, to be able to have a bowel movement properly, to be able to have penetration, so be intimate with your partner without pain. So for those things, your muscles need to be relaxing. I have many young women who, if you look at them externally, has the perfect body, is so athletic. They've been doing core exercises since they were 3 years old. My young gymnasts, right? A lot of my horse riders, they have the most beautiful, active, like Pilates body, but they have such tight pelvic floor muscles. By the time they get married or now they're trying to have children, they have horrible pain with intercourse. A lot of the times they can't empty their bladder properly and they're retaining that urine, which can cause infections and other problems. And a lot of that is because they have what we call pelvic floor dysfunction. And all that means is that it's not relaxing and tightening the right way. There's an balance is off.